My first guest is Dr. John Lynch, who is a cardiologist with Baptist Health Lexington and Lexington Cardiology. Welcome.
Good to be here.
Well, you know, we always think, when you think of heart attack, most of the time it's men you think of, but women have heart attack, and it's apparently a big deal.
It is a big deal, and I think in order to understand the problem, you really have to look at how we've looked at heart disease for 50 years. You know, going back 50 years ago, we really thought this was purely a man's problem. And we put a lot of energy and focus and time and education and research into really addressing the problem in men. And what you started to see was, over time, heart disease deaths in men began to fall, okay? But what was happening in the background is that more women were dying of heart disease. And so by the time you hit 1984, in the mid-'80s, more women were dying from heart disease than men every year. And that surprised a lot of people. In fact, 1 in 4 women will die from heart disease. 1 in 2 women will be affected by it. It kills more women every year than all cancers combined. And only about half of women realize that this is their #1 risk in life.
Well, when you say risk, who is at risk?
Really, it's anybody with the typical risk factors that we know about in men. So if you're diabetic, or if you have high blood pressure, if you have abnormal cholesterol, if you lead an unhealthy lifestyle, you don't exercise, if you have a bad family history, all of those things put you at risk of having a heart attack like it would a man.
Now, when you think of a heart attack, you think of crushing substernal chest pain. Is that always the case, or do women sometimes present different? Are there something that they should be looking out for differently?
Women often present differently than men. Women can definitely have that crushing substernal chest discomfort, described like an elephant sitting on your chest, just like the Hollywood pictures. But women often have multiple different symptoms, not just chest pain. Sometimes they'll have severe fatigue or nausea. Oftentimes their discomfort will be in different places. It'll be abdominal discomfort or pain between their shoulder blades in the back, even pain radiating up into the jaw. And so women often present with multiple different pain issues, and sometimes that can throw off providers a little bit when they're evaluating women with symptoms like this.
So when a woman has a symptom like that, you hate to tell them they ought to be seen all the time, but maybe they should. What are some warning signs that say, hey, come on, don't ignore this?
Any of those symptoms, I think women should be evaluated for. And it may not be heart disease all the time, but it's something that we need to think about. It's interesting that women think that their symptoms are due to stress or anxiety twice as much as men do. And when physicians evaluate women, they're often less likely to think about heart disease than something else. And so oftentimes women get missed. It's just harder to pick up.
Well, you mentioned blood pressure as a risk factor. Mm-hmm. Every time I read an article, they're changing the target for blood pressure.
Right.
Is there some goal we ought to be paying attention to?
There's been a lot of confusion and changes in how we look at blood pressure. For years it was 140/90, that was our number. Anything above 140/90 was high blood pressure, anything less than 120/80 was normal, and then anything in between was kind of pre-hypertension, where we just watch people really closely. And then we found some information that, well, maybe you can let older people run a little bit higher blood pressure, but then we backtracked a little bit this last year, and when the new guidelines came out, we set 130/80 as the new blood pressure target. That includes a lot of people as now being hypertensive. It's going to account 50% of the U.S. population is going to now be hypertensive. And so I think the bottom line is if you're a patient, if you're a person, and you start to see your blood pressure creeping up above 120/80, you need to really get serious about lifestyle and diet, watching your salt, and to make sure that doesn't progress further onto true hypertension.
So managing the risk factor is just as important as a woman, and maybe even more so than a man.
Absolutely.
All right, that's really, really, really great information. So if you've got a symptom and you're at risk for heart disease, make sure you see your provider.